Hi, and thank you for watching this recorded presentation on the draft community health goals and policies for the Envision Eugene Comprehensive Plan. My name is Stuart Warren. I'm an associate planner on the community planning and design team. I'm thrilled to be back presenting on another round of draft goals and policies for the comprehensive plan. The comprehensive plan is one component of the Urban Growth Strategies project. This project is identifying the tools, actions, policies, and land needed for the next 20 years for living wage jobs and housing that everyone can afford. This is one of a series of presentations on the comprehensive plan. In this presentation, I'll provide a brief overview of what the comprehensive plan is, an overview of the draft goals and policies for Chapter 5, Community Health, and lastly, I will outline next steps and ways that you can provide feedback. Let's talk briefly about what a comprehensive plan is. If you'd like to learn more, I encourage you to watch the recorded presentation on the comprehensive plan. The web address is included here and at the end of the presentation. The comprehensive plan guides the city in its land use planning for future growth within the urban growth boundary. It is informed by years of community engagement through Envision Eugene. Each chapter has a series of goals that articulate the overarching aspirations of the community. Each chapter also contains policies. These policies will provide a consistent course of action and move the community towards attainment of its goals. Once adopted, the policies guide the work of the city staff in formulating proposed changes to development regulations, long-range planning projects, and financial decisions. Before we dive into the draft goals and policies for Chapter 5, I want to provide a quick disclaimer. These goals and policies are in draft form and will likely change because of the input we receive over the next year or so. Because of the number of policies, I'm only going to highlight a few of them. To see all the draft goals and policies and complete your survey, please visit the Project Engage Eugene page. The link is on the bottom of this slide and at the end of the presentation. This draft community health chapter currently has 3 goals and 22 policies. The community health chapter of the Envision Eugene Comprehensive Plan guides the city's efforts when planning for future growth and development that provides a healthy, natural, and built environment, enhances equitable access and opportunity, and fosters community safety and belonging. The first draft goal is on healthy, natural, and built environment. The goal language is provide a healthy, natural, and built environment throughout Eugene so community members can have access to clean air and water, experience nature in their daily lives, and live in places that are protected from environmental contamination. Under this draft goal, there are currently 9 draft policies that help to attain the goal of a healthy, natural, and built environment. A few examples of draft policies include pursuing the fair treatment of all people, including people from underserved community groups, with respect to the development, implementation, and enforcement of local environmental laws, regulations, and policies. When redesignating land, the city shall avoid locating heavy industrial and residentially designated land adjacent to each other. Continue to monitor, plan for, and enforce local land use regulations of air quality, water quality, and noise standards. Other policies in this section cover topics such as coordination with regulatory agencies, urban tree canopy and green streets, and park recreation and transportation planning. The second draft goal in this chapter is equitable access and opportunity. The goal language reads, enhance opportunities for all community members to improve their quality of life through access to affordable and safe housing, food, employment, and public facilities and services. To help realize this goal, staff have drafted 6 policies. The draft policies include topics on promoting fair treatment, access, opportunity, and advancement for those most burdened by past and current injustice by acknowledging and striving to eliminate barriers to inclusion and integration into city land use planning efforts. Enhance the pedestrian experience throughout Eugene with a specific focus on underserved communities through public and private development that creates accessible, safe, and attractive places for people who walk and/or use wheelchairs or other mobility devices. Work to increase safe, affordable, and accessible childcare facilities throughout Eugene by reducing regulatory barriers through actions such as allowing childcare as an outright permitted use in more zones, simplifying application processes, and aligning definitions. Other policies in this section cover topics such as access to social services and healthcare, arts, culture, and recreation, and more. The final draft goal of the chapter is titled Community Safety and Belonging. Foster a safe and inclusive city where all people, including those from underserved community groups, feel a sense of safety, connection, and belonging. This goal has 4 draft policies. They are encouraging the design of welcoming and safe community gathering spaces for flexible uses to encourage community interaction and events of differing sizes throughout the city. Support plans that mitigate the impacts of involuntary displacement, such as eviction or rising rents, on local businesses in order to help maintain the ability for local businesses to stay in their neighborhoods. Work to remove barriers to locating and siting emergency shelters, including emergency shelters for people experiencing homelessness and mass sheltering related to natural disasters. If you're interested in learning more about transitional housing policies, check out the draft Chapter 4 Housing Goals and Policies on the project's webpage. And the final draft policy in this section is about encouraging urban design practices that incorporate crime prevention techniques, such as increasing visibility through clear sight lines, lighting, programming public spaces for increased use, and other best practices. Our next steps for Chapter 5 include collecting community input on these draft goals and policies. This video, its survey, and other materials are currently posted on the project's Engage Eugene page at the web address shown here, and I encourage you to let us know what you think. This year, staff will be working with a community advisory panel and other groups like the Sustainability Commission and Active Transportation Committee to ensure their needs and priorities are accurately reflected in these draft goals and policies. Then, later this year, staff will be refining the draft goals and policies as needed with the Eugene and Lane County Planning Commissions, City Council, and Board of Commissioners. Again, I'd like to encourage you to watch all of our chapter videos and tell us what you think. All materials can be accessed by visiting the project's Engage Eugene page shown here. You can scan the QR code or follow the link on the slide. We'll be posting videos like this one with surveys for each draft chapter, and those surveys will be available through the end of July in 2025. If you're interested in learning more about the Comprehensive Plan, please visit the Comprehensive Plan webpage, also shown here. And lastly, feel free to reach out to project staff, like me, with any questions, thoughts, and feedback by sending us an email. With that, I want to say thank you for watching this presentation and taking the time to learn more about the draft community health chapter of the Envision Eugene Comprehensive Plan.